My next guest this morning is Dr. George Hoogeveen from the Allergy Relief Center of Frisco. If you or someone you know suffers from allergies, you're going to want to stick around to hear what the doctor has to say about some new advanced technology that reportedly is taking the pricking, poking, and medications out of allergy treatments. Dr. Hoogeveen, thank you so much for joining me.
Thank you. It's a pleasure to be here.
Well, here we are, the month of September. Fall allergies are in full swing. And I know that for me, personally, fall allergies are the worst. But, you know, before I moved to North Texas 15 years ago, I didn't suffer from any allergies at all. And I hear that from a lot of people. What's going on? Are allergies just more prevalent nowadays?
Well, they are. And it's, if you look statistically, there's over 60 million people in this country that suffer from allergies. And unfortunately, those are just the ones that are actually seeking care. So we know that there are millions more that are actually out there, taking over the counters or trying to do something themselves. And it's sad and it's staggering, the number of kids that come into my office every day with a list a mile long of the foods that they need to be avoiding at school or what they need to avoid at a birthday party. It's sad when I see that. I treat these children as they get better. We joke with the parents that when the kids first came in, it was kind of like Ghostbusters. There was snot and they were leaking everywhere and they were itchy and red. And it was so sad for them initially. But even the number of adults that are coming in and they're just chronically year-round allergic to something. You mentioned that right now it's the fall season and you're starting to feel it a little bit. A lot of people report seasonal stuff, but I've got so many patients who have it year-round. And it's almost become epidemic. And I think any allergist or epidemiologist would tell you that. And I think it's sad, and it's something that we're trying to really deal with.
I often wonder if it's the air quality. As our air quality has gotten worse, that the allergies get worse.
No question about it, especially when you become hypersensitive. There's a lot of theories out there as to why we're seeing more and more allergies and what the prevalence is for. But at the heart of all of those allergies, or at the root rather, is stress and how your body responds to stress. And I don't just mean everyday stress, I'm tired, I'm stressed out. Chemical stressors, physical stressors, emotional stressors. It's amazing how the body will react to different types of stress. And I always emphasize this with parents. Our immune systems were supposed to be challenged, particularly early on in life. And I think on some level we have over-bacterialized and antibacterialized rather, and sterilized ourselves into this bubble. And your body really is supposed to be exposed to viruses and pathogens and bacteria that strengthen your immune system. And I'm all about sanitation. I think in the last 50 to 100 years, sanitation and refrigeration has done as much for general public health as anything. But on some level, we've really kind of sterilized ourselves, and we haven't challenged our immune systems the way we probably should have. And so we have what we call weakened immune systems that tend to overreact as opposed to appropriately react.
And that's what we need to understand about allergies, is an allergy is our response.
Exactly. By definition, an allergy is nothing more than an inappropriate response to a harmless substance. So, for example, pet dander or grass or even some vegetables and fruits that are normally healthy or harmless, your body is overreacting to those as if it were a virus or a bacteria or a pathogen, and then you have the stress response, which is the release of the histamines, and it's why we end up taking so many antihistamines. And that, of course, deals with the symptom, doesn't deal with the inappropriate response that you had to that substance.
Now, you're a chiropractor, and a lot of times when people think about chiropractors, they think about, I've got a sore neck, I messed up my knee, my back. You don't think about allergies. How did this come about, you treating allergies?
Well, I always tell my patients, don't let my designation dictate what I may or may not be able to help you with in life. And so with regard to their health and their physiology, I always try and encourage them to understand two concepts. Number one, your body has requirements. There are certain things that you and we all need in order to function optimally or as close to optimal as possible. If we don't get those things in life, I don't care if it's sleep, food, water, exercise, spinal alignment, whatever it is, your body's going to break down on some level. At some point, you're going to develop a disease process because they didn't get what they needed. So we call that a deficiency. The second concept that I try and get them to understand is that we have limitations. So, for example, if you exceed those limitations, again, the body can handle quite a bit. We throw a lot at our systems in this day and age, and it's amazing that we don't get sick quicker. But when you exceed those limitations, your body becomes toxic, and again, you break down. So whether you're toxic because of too much of something your body can't handle, or whether you're deficient because you didn't get what your body needed, you tend to break down, and the stress response comes along, and then you have the release of the histamines or something else. It doesn't just have to be allergies. So as a chiropractor, my goal is to understand or to help patients understand this concept of holism or wellness. Yes, sometimes it's about spinal alignment, but other times it's about providing the body with the simple things that it needs in life. And it's really more educational than anything.
My guest, once again, if you're just joining me this morning, Dr. George Hoogeveen from the Allergy Relief Center of Frisco. With the recent rains in the area and with the change of season, many people are dealing with seasonal allergies. It's estimated that as many as 60 million Americans are allergic to something, and allergies are the country's 6th leading cause of chronic illness. So we're talking about allergies and allergy treatments, and you apparently have this revolutionary treatment. What exactly does this new revolutionary treatment entail? They say no pricking, no poking, no medications. I'm liking that.
Yeah, most people do, and that's a fear and a concern, especially for a lot of people that have come into the office that have tried a year or two worth of desensitization shots, or they've been taking a lot of medications. Earlier, we talked about an allergy being an inappropriate response to a harmless substance. And if your body has learned that response, it can also unlearn the response. So when I tell people what we do, I want them to think about a couple of concepts. First of all, we need to reduce the stress load, the overall stress load. We talked about chemical stressors, physical stressors, emotional stressors. When your bucket, so to speak, gets full enough, you tend to see a manifestation of not just allergies, but other conditions, whether it's chronic fatigue or whether it's headaches, gastrointestinal dysfunction. That can actually be an allergic response. So with regard to the technology that we're using, it's positive conditioning is about the best way I can explain it. Your body perceives pollen, for example, as being harmful, and it reacts to pollen as if that pollen were a virus or a bacteria or something that the body has to get rid of. Your body has to flush. And if it were a virus or a bacteria, that would be appropriate. The fact that it's pollen or bananas or whatever, clearly there was an error in perception on the part of your immune system. So our goal is to retrain your immune system through positive conditioning. So the technology works like this. I expose you to a frequency, a digital frequency, that mimics the pollen. We do this in the office. So you're not actually being exposed to the pollen. You're being exposed to a frequency that the body perceives as pollen. At the same time we're doing that, we promote a release of endorphins in the body and enkephalins. And these are pleasurable hormones. Your body releases these chemicals when they are relaxed or when there is pleasure being experienced. The next time you come in contact with that substance, the pollen, your body associates that positive response and it no longer reacts inappropriately. So it's positive conditioning.
The machine that you use is called a BAX 3000?
It's called a BAX 3000, yes. It's an FDA-cleared machine, and it really, if I had to qualify it for somebody, it's like biofeedback on steroids. It's unbelievable the way it's working.
It's the Arnold Schwarzenegger,
it's the Arnold Schwarzenegger of biofeedback. Absolutely. I like that.
So how many treatments, if someone is interested in going this route, how many treatments before they see any relief?
Probably the second most common question that we get from patients. And here's the reality. We do a very thorough history, and I try and group people into mild, moderate, or severe categories. And based on that classification, some patients we test right away, some patients we wait, and we test them a little bit later. I joke with some patients and I say, if you were quite overweight and out of shape, you probably wouldn't walk into a cardiologist's office and have them put you on a stress test because it wouldn't be beneficial for you or for the accuracy of the test. So people that are very severe, we wait a little while to test them and we simply desensitize them. Others that aren't quite so severe, we'll test them right away. And typically what it takes is 1 to 2 treatments per item. So for example, if it's